It's Tuesday on Your View. Welcome to the show. I am Mariah Afolabi Brown. As always, I have the ladies. Hello, YK in the building.
Good morning.
How you doing, Chikwe? YK, I love the pink.
Oh, thank you.
How you doing?
I'm fine. Last week, after I think it was Friday, an old musician of my father's passed away.
Yeah.
His name was Tony Allen, a drummer. But, I mean, very sad and everything. I think what upset me about the whole thing was...
misinformation?
That they were saying, the misinformation. They were saying that he created Afrobeat with Fela, which is not the case. I even hear that a former commissioner of tourism in Lagos said, I was only saying that, I said it on TVC because I'm Fela's daughter, which is not the truth. If my father created something, because it's my father, I shouldn't say it, you know. Tony Allen was a brilliant drummer.
And
brilliant.
History shouldn't be rewritten. And
history, I don't know why they are writing history, you know. So I just thought I would mention it.
That.
It was good because a lot of time misinformation will spread if you don't correct it, and where lies will get to, truth cannot catch up with it. So it's always good to put the right information out there. Fela created Afrobeat.
I like that. Where lies go?
The truth will not get there.
That's so true.
Let's just always put the truth forward.
The lies that have been spoken. Wow, fantastic.
We're grateful to God.
How come I never heard that before?
It's true, because 30, 40 years, when
somebody
all of us have left, they will be, that's how misinformation continues to...
How are you doing, YK? Good?
I'm very fine, very fine. And my brother's children, they charged them yesterday for online 40K per month.
That's cool, right?
My brother said, I'm the one teaching them. And I was watching them. And it's WhatsApp. It's not Zoom, it's WhatsApp. And
so I can understand.
And the teachers don't even always come. And the two boys were there just playing. I was watching them.
Ours is better.
Then, but at 12, they said, well, nobody has talked to us. Well, at 12, okay, we are closing. When they get up and they went away, I said, look at
Why do I find this so interesting? Because we were fighting on our own platform. Like the parents in our own school, they're like practically using, you know, those that went to school. They, you know, they just construct one message. I was just enjoying. I was enjoying. Like, we have some scholars in this place. But you know, eventually we agreed on the figure, and it's even better than yours. I mean, we actually are online.
It was higher before, but I think that
how much is yours?
We can't say it's on national TV.
But it's lower than...
People don't know your school, but
people know our school.
So let me not mention it. But our school is affordable. I think it makes sense. I think it was a good compromise.
Tell me.
I'll tell you after the show.
Private.
Anyway, how you do very quickly?
I'm good. I'm very, very good. And I realized that with the Office of the Citizenry, we don't take ownership. We don't participate. And the reason we were able to drive the school bill down was because everybody participated in agreement to say this is what we want. As for Nigeria, too, we all need to get more involved. We can't be doing by the side. Everybody needs to speak up. You're abusing the politicians, but when they say go to a party, you say it's dirty. Then you want your government, your country to get clean. Like, we need to get more involved.
That one is even good. The other school, check 80K.
Hey, YK.
Protest.
I'm sure they would have come down by now because most schools...
This is just yesterday I heard.
Yesterday.
So, YK, when our school found out, the school parents came together, even outside the PTA, and got a consensus, sort of. And then
you know, all of you are in the same church.
No, not really.
I'm not in that church.
She's not in the church.
I'm not in the church.
But you are all...
I was very silent in the group. I didn't say a word.
That's why you were silent.
I didn't say a word. I just kept quiet. But it was interesting to just see people's comments. But it was nice. I mean, I like the fact that we finally made a decision. Anyway, today is World Hand Hygiene Day. How apt.
Very, very important.
Hand hygiene, obviously, is the single most effective action to take to prevent infection of the spread of pathogens. And that's what we're going through today. So it's important you keep washing your hands. Anyways, we have to go on a break. When we come back, it's Tuesday. We're going to go through the pages. And we have some important guests today to clarify a lot of these COVID-19 issues for us. Stay with us. We'll be right back. Oh, I forgot to appreciate somebody sent us beautiful face mask. I have to get his name and I'll bring it back tomorrow. Very fantastic work he did there. The Nation. Return to lockdown likely. Federal government warns Nigerians. Buhari seeks debt cancellation for Nigeria and others. Government receives 311 million Abacha loot. You know, I wanted to read that, so I kept missing it. COVID-19, Wike shuts down Port Harcourt, and trucks smuggling 92 persons into Lagos Kwara intercepted. Okay, which one are we taking? Do we take the major headline, likely to lock down again?
Yes, yeah, yesterday it was terrible. The videos, the picture, as you can see in the picture story, obviously because of the way people didn't comply with social distancing, the buses, the markets were full. What the government has said is that they would likely bring back lockdown because they can't seem to control the crowd and how we are reacting to the easing of lockdown. And I'm worried that might be the case. It's really sad. I
heard the commissioner actually say it on TV yesterday that if it wasn't even the chairman, I think, of PTF, that said, look, this is it's not acceptable.
Right.
And another thing is that he said that's important is that the banks, they gave them the permission to open the banks. The banks now open branches. Yeah. So everybody went to those branches, which is why there was such an influx of people. Because if my house is in Ikeja, my bank is in Agidi, is on Agidingbi Road,
and there's no branch open
there's
around
no branch.
there.
I will go to the next one, and everybody was converting on these banks.
Okay, I was going to say that our president is asking for debt cancellation for not just Nigeria, other African nations, and actually we're indebted to World Bank, Beijing-based Export-Import Bank, Euro bonds, and I think there's one more. I can't see it right here, but
and
generally,
took the story.
Yes, Bloomberg took the story, and we're actually so hopefully, I don't know if that how possible it is.
He's hinging it on the economic downturn that would happen due to COVID-19. That on behalf of all this, African countries that are heavily indebted, there should be outright cancellation.
Because if you recall, there was an initial concession that we'll pay only the service charge, of, I think, for a period. But now they're saying no, outright cancellation, that we can't even
but once you take the story of trucks, see, Nigerians, let's be good, let's be kind to each other. So there was a truck intercepted coming from Zamfara.
Okay, that was in Punch as well.
Okay. Yeah, I was going to take it in Punch. Let's take it in Let's move on to Punch. Prepare for total lockdown if COVID-19 cases rise, says PTF. We talked about that already. 60 Lagos-bound men intercepted in trucks conveying cows. Melaye sues Gbajabia Miller, others for controversial NCDC bill. Driver sentenced to death for killing employer's mother. U.S. has repatriated $311 million Abacha loot, says Malami. Evacuation of 700 Nigerians in U.S. begins Sunday, and Senate probes SIP cash transfers, palliative distribution. Okay, let's start with the interception that happened in Lagos State. Go ahead.
Yeah, the truck was coming from Zamfara. He was transporting cows. Something said they should just search the truck, and they found 60 men.
Hidden under.
They managed to, a lot of them jumped out and ran away, but they managed to collect 42 and they sent them back. And the motorboy truck was saying, he doesn't know why they're stopping him. He doesn't know why they're stopping them. Maybe they're supposed to take food, they're going to. But they said, if you're coming with a truck of food, you can only be 7 human beings inside. So they've transported all of them.
That is scary, YK. Because, and that's one of the questions I was going to ask the commissioner, because the truth is that's not the only entrance into Lagos State. There are multiple entrances. So who is manning those areas? And are there people also smuggling people into the state? So that's a huge problem for Lagos.
That Suya guy I told you about coming from Kano.
Probably that was how the person came through.
Let's pick one more story.
Yes, so Nigeria is about to receive $311 million Abacha.
They've received it already.
Yes, they've received it. It is under Abacha 3 agreement. It's the same one we've been covering since, coming from New Jersey. So,
and it was just so coincidental that it came during COVID-19.
No, but they said what the government said was that according to the agreement, this money is going to be going to Lagos Ibadan Expressway and many other projects. So this is it's not going to disappear. They already earmarked projects for this money to go into. They said Abuja Kano Expressway and the second Niger Bridge. So these 3, the government will invest in assets expediting the construction of those 3 major roads, Lagos, Ibadan, Abuja, Kano, and Second Niger Bridge. Okay. So we can hold them accountable on that.
Former Senator Melaye is suing Gbajabia Miller and others for the NCDC bill. He's obviously, the issue that they feel is draconian, the fact that you can actually just take over people's properties and the forceful vaccination, amongst other things. So not just him, the civil society are also
civil society have
supporting him. And that,
come on board.
It's not been passed, so can they sue on a bill that hasn't been passed yet?
Well, at least I think that, that's what we're asking for a public hearing, before even to discuss and rush it out.
Because they have already passed second reading.
Yes.
So his fear is they will pass the bill, and there are a lot of draconian that they can come and take over your property and say this is going to be. I mean,
we discussed it yesterday.
Yeah, we mentioned it yesterday, but there are a few grey areas in that bill that we still need to address that we have not talked about. But we'll talk about it when we have a guest.
I was listening to the radio today and they said it was actually lifted. The bill was actually lifted from the Singaporean bill. And Singapore is not a democratic regime.
And we asked about it yesterday, and he said that, our guest, the Honorable, said yesterday that, yes, most laws are actually taken from different places. However, it will be domesticated for Nigeria. So I think many of them actually haven't seen that bill.
Yes.
The truth is that many, because they did mention in the papers that all of them haven't seen it. It was presented, and I think there was a general acceptance, but they still need to go back and look at that, because the other issues we raised that unfortunately the House of Assembly member was unable to answer at the time. Moving on now to Vanguard. PTF moves another lockdown. We talked about that earlier. Let's find a story we've not taken. 82.9 million Nigerians below poverty line, says NBS. Wike gets tougher as Port Harcourt Obiakpo gets 24-hour lockdown. Herdsmen Boko Haram have killed more people than COVID-19, says Anambra Khan. And 39 CSOs kick against the NCDC bill. We talked about that already.
So,
okay.
the Wike is taking a very tough stance, Governor Wike is taking a very tough stance concerning Port Harcourt, saying that specifically Port Harcourt City and Obiakpo local government areas will be on complete lockdown. This is because the 14th case of COVID-19 was flown in through the helicopter by Bristol. And he was saying that he came in from Akwa Ibom on April 29th. So for him, the statement he released was that every flight coming in, though essential, must be verified. Any helicopter flight coming into the state must be verified. The name of all the passengers must be given to the government before they are allowed in, and their location should be made disclosed to the government so they can trace any individual bringing in anything into the states. And I think every other governor should become that.
He's on point. Why should you bring someone with COVID into my state and then I cannot
access the person?
Okay, I was going to take one more story. 82.9 million Nigerians below poverty line, says the National Bureau of Statistics. However, president of the Banks Customers Association, Dr. Uju Ogubunka, has said that is too conservative, that there's no way after this COVID we won't have a 20% increase in that number.
They said Bono wasn't
included in that. Wasn't captured in that, yeah. Moving on now to the Nigerian Tribune. Bizarre scenes in Lagos, Abuja as COVID-19 safety rules fail. Let's find the story we've not taken. Court declares disruption of revolution now. Protest illegal. Awards 1 million naira damages against federal government. Oh, I wish I read that story. 16 doctors infected with COVID-19 in Lagos, says Medical Guild. Alleged 714.6 million naira fraud. EFCC arraigned former Minister Turaki and aide. U.S. COVID-19 patients to begin the remdesivir treatment this week, and over 82.9 million Nigerians have lived below poverty line. Okay, Mike, you want to tell us that story?
A lawyer for Revolution Now, Olukoya Ogunbeje, said he participated in the Revolution Now protest, but they were disrupted before they could take off and arrested. And the judge has said that it was unconstitutional, undemocratic, and one other big oimbo, that they have to, so they've fined the government.
So the government is paying $1 million naira.
1 million naira. They wanted 500 million.
Yeah.
But the judge said no, and she actually removed DSS because she said DSS were not involved in that.
I will quickly take the story of...
Because she added DSS and everybody together.
Quickly take the story of medical workers. And my plea is that when you are advised to stay at home, there are many implications to it. It's not just about your health and your money. Medical workers are being exposed. We don't have enough medical workers. 16 of them, new cases confirmed from medical workers who have now have COVID, which means we don't have enough hospital hands to treat you. Please stay at home and protect yourselves and protect the other people that are essential to work.
We have to run. Let's go on a break. When we come back, we get some updates on COVID-19 with the NCDC chairman. Stay with us. We'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So the National Center for Disease Control, NCDC, has been on the forefront lately, ranging from necessary help to making sure they have enough hands to cater for those sick and to also help control the spread. Joining us for more information concerning the spread of this is the DG, Director General, National Center for Disease Control, Dr. Chikwe Ihekweazu. Good morning, sir.
Good morning, ma'am, and good morning to everyone watching your show.
Good to have you on the show, finally. We've been trying to get you for a while.
For a long while.
But good to have you. Anyways, let's go straight into it because we have so many questions to ask you. Obviously, from the reports today and even yesterday, do you think easing the lockdown was a mistake on the part of the government? And if it was, how soon do you think you can then have us go back home because of the obvious spread that is imminent from what happened yesterday?
So thank you very much. On our side, we don't think it was a mistake. We knew at some point this day had to come.
Right.
But we really expected Nigerians and corporate Nigeria to take a little bit more responsibility for what happened yesterday. Right. There's only so much government can do. You know, we can issue lockdown, we can bring out the police, we can, do so much. But we rely on the common sense of most Nigerians. We rely on corporate Nigeria taking responsibility. This is not being done for NCDC. It's not being done for the federal government. It's not being done for the state government. It's being done for us. So, we really are counting. Let's take yesterday as an exception. Let's take yesterday as a blip. Let's see what happens today. Let's see how many corporates come out from their offices and organize the queues in front of their offices.
Right. Okay.
Let's see how many corporates organize their office spaces and actually put out the hand washing and educate their staff on the changes that they need to do for themselves. This is not being done for us, it's being done for you.
Right.
So all of us have to take responsibility.
All right, let's get a few more questions in for you. Go ahead.
I totally agree with what you just said. We've been preaching the same thing. I wanted to ask you concerning Kano. We discussed it yesterday, and a representative of Kano State from in the Senate or House of Representatives, I believe, mentioned that NCDC was the only one that has a right to put in testing centers. And we found out that for a period of 1 full week, there was no testing center in Kano State, which also might have caused the spread as much as this. What would you say to what happened to Kano State? Where would we put the blame? Shouldn't you have known better to put the center there, knowing that it was a hub of lots of activity and the population mass there? And would you take responsibility for what happened in Kano?
So, I'd like to clarify. One thing is for sure, testing is one small part of this entire response, right? The response is a multi-stage response, of which testing is a component, a critical component, but just one component thereof. We are paying a price collectively for our insufficient investments in testing infrastructure across the country. And there's only so much we can do in a few days. I've been to Kano 2 times in the last 10 days. There's no state more important to us right now to get on top of this. We were under pressure to establish a lab. We established the lab very quickly in collaboration with the Aminu Kano University Teaching Hospital that actually owns the infrastructure for the lab. Now, there was a contamination event there, which often happens in labs. We had to shut it down and start again. But the good news is, right now there are 3 labs testing with a combined capacity of 600 tests per day, which is not even fully maximized at the moment. At the end of the week, we'll be up to 1,000. If our plans go right, by the end of next week, we'll be up to 2,000 tests. Right. So the testing capacity, even today, is not the challenge in Kano. It's a full spectrum of the response, and we're working hard, not just with Kano, with 35, 36 other states in Nigeria to scale capacity.
Right.
So, when you're in a war, sometimes, certain battles are difficult, but the challenge is you've got to keep your eyes on the goal.
All right, great.
Our goal is to win the war on COVID-19.
Right.
And we must stay on it, stay on the ball, and that's what I'm asking everyone to do.
Right.
In government, out of government, in media, in corporate Nigeria. Okay. Let's stay with the ball.
I have to get a lot of questions in for you because, trust me, we have little time. Go ahead, YK.
I've heard many reports on NCDC not being able to meet up with people with
COVID-19.
Yes, COVID-19. The one I heard 2 days ago was actually someone very close to me. The Malam was showing signs of COVID, and they called NCDC. Or they said, they didn't have enough beds, that they should keep him in the house. So they couldn't come and pick him up, but the guy was coughing, he had a high fever, and there was he had chest pain. So I'm asking you, are you sure you are meeting up to the demand?
Right.
So, these days, NCDC is blamed for everything. Well, we never respond because we believe that this is an all of government and all of society response. The reality is that we're working with the state government. The state governments actually have the responsibility for case management. They provide the beds, but we're all struggling. But the key thing for Nigerians to watch your TV every night. Every country in the world is struggling. No country in the world can increase its bed capacity by 300, 400% in 2 days, in 2 weeks. It's simply impossible. So we're doing our very best, working with state governments, working with the private sector.
Right.
COVID has supported the expansion of bed capacity in so many states in Nigeria. That's the private sector. So we're working very hard. The logistics of calling a call center, getting the ambulance from the state government, taking the patient into care, sometimes is difficult. But every day we're improving these processes. It's improved so much in Lagos. We're working with Kano to improve. FCT has improved. So I'm just asking Nigerians to be a bit patient.
Okay.
But must be rest assured. We're working very hard to make the process smoother for every Nigerian in need of care.
All right, let me take you to Sokoto State because they've had 4 fatalities so far. And there's no lockdown in that state. Yes, they've blocked the borders, but life is as resumed as normal. Ramadan, they're having their fasting, their group meetings and prayer meetings. It was in the papers today. And that's worrisome. We don't want a situation whereby it becomes something like what we're dealing with in Kano. So what is NCDC doing to ensure that Sokoto doesn't aggravate to that point? That's one question. The second question I was going to ask is, we're also hearing reports out there about this herd immunity where the strongest survives. Is that what the government is going to fall back eventually on? I mean, does it mean that at some point we're going to leave this for everybody to contact and eventually those who survive? Is that something we're thinking? Because we're hearing that other countries may have considered that option. 2 questions in one.
So, thanks. I mean, remember we're a federal republic. From the federal government, from NCDC, we definitely don't have any enforcement powers. We offer guidance, we provide support to the states, we encourage people, we ask you to take responsibility. The federal government from the PTF provides guidelines and we can put that into regulations. But ultimately, the state governments need to come to the table. There are many, Sokoto is not the only place we're struggling with. There are other state governments across the country. Some are doing very well. I must really appreciate the state government that are being so proactive in doing this, but not everyone is. So this is really for all of us to come together, state, local, and federal government, around the same goal of preventing transmission. On your second question on herd immunity, nobody wants to wait for herd immunity. That's why we're part of a global effort at the moment to develop new vaccines to stop transmission. We're contributing our knowledge base to this. I am in touch with the colleagues working on this through the WHO almost every week. Our goal is to get to a vaccine as soon as possible. Until we get to a vaccine, as public health experts, we really don't have any other choice but to limit transmission. And that's where everybody needs to come to the party. There are 3 primary things we're asking every Nigerian to do for the next few months. Increase your physical distancing. Secondly, avoid mass gatherings. And thirdly, wash your hands, Today is Hand Hygiene Day, World Hand Hygiene Day. So I hope every organization, everybody watching this show must go out and show solidarity, make sure your hands are clean, and make sure this is a culture that lasts well beyond the duration of this outbreak, wherever you are.
Okay, Waki, go ahead.
That brings me to my next question. You said you're waiting, or you are working with the global community for a vaccine. I would have thought at this time, because I know that Nigerians, even you, I'm sure, are very brilliant doctor. We have brilliant scientists and doctors here. Why don't we, like Madagascar have done, like Senegal are doing, look inward and start to find a remedy that is suitable to Nigerians? Because I personally think that the lockdown is not the solution. That's my own personal opinion. But instead of waiting for America to come, because tomorrow America will come up with the vaccine. Yay! Everybody, why can't we be? Look, our oil is not bringing money now. Maybe vaccine will bring money.
I'll throw that question back at you. We are open to looking at any remedy. If you have a remedy, please bring it.
We have been saying it on this show.
Oni of Ife has said it's
No,
remedy.
you
Oni
are
of Ife has said it. We have been saying it about a local remedy.
If you have an alternative to physical distancing, please bring it forward. It's not good enough to just say, let's do this, let's do that. Bring it forward. There's a challenge to every Nigerian. If you have a local remedy, bring it forward.
Okay, so have you seen what Oni has sent? The Oni actually sent in a remedy. Have you looked at it? Oni of Ife.
Listen, my responsibility as the leader of the Nigeria Center for Disease Control is to do the very best possible with what I have in my hands to protect the health of all Nigerians.
Okay.
This is what I do 24/7 every day of the week. I'll continue to do that. If there are remedies that show that they work, we are happy to have them within our arsenal.
Doctor, so I would like to say that you're about to become more powerful. Have you heard about the bill? There is a bill at the Federal House of Assembly, and it is about to make the DG of NCDC very, very powerful. Some of us have gotten a few ideas. People are protesting against some parts of it. Some people feel it's draconian. Have you seen the bill, and what do you think?
So I don't want to comment extensively on the bill. I've done that already. I've said, listen, the 3 comments are made. I am very grateful that everyone is now conscious of the risk and the threat of infectious diseases, and I completely understand the emotional point of view and where our lawmakers are coming from. The only tool they have in their hands when there's a crisis is to make laws, they are trying to do exactly what they can do. My position has been, in the middle of a crisis is not the best time to make a new law. So let's get out of this, consult all stakeholders, and make sure we have a consensus on how to move forward. On your first question, I haven't been privy to the bill. We haven't been consulted on it formally. And until that happens, I'm not in a position to make a comment on the contents of the bill. So those are my 3 comments. But, this is good that this is now in the consciousness of Nigerians and something that we have to address proactively moving forward.
All right, we have to wrap up with you because of timing. But a final question. I know you've gotten this question 1,000,001 times, but I'd like you to address it one final time. Testing capacity. Where are we today? Because every day people are saying Nigeria is one of the least countries with enough testing capacity. What have you done so far to ramp up those numbers across the country?
So we are working day and night to build up this capacity, where the numbers you see that are increasing every day are not increasing out of the sky. They're increasing because we're testing more. Yes, we started from a challenging base, but this is reflective of the challenges that we have across our country. Whether it's electricity, whether it's road infrastructure, we are where we are as a country. My responsibility, the responsibility of the Nigeria Center for Disease Control and all the state governments is to now push from where we are to make sure we're never in this type of position again. So we're working on solving the short-term challenge of increasing test capacity for this particular disease, but at the same time, we always have our eye on the ball, never to be in this situation again. So we're working with everyone to build up our molecular diagnostic capacity across the country so that every state at least has one molecular lab in its state. I've assured our state governors that this is our goal and we will work towards that goal. But for now, we've set ourselves a goal of 2 million tests in 3 months. It's an ambitious target, but it's one that we will work towards in order to enable us.
I need to squeeze in one last final question for you. Sorry about that. Go ahead.
Sir, everybody's saying that the test kit is expensive. Have you considered the Senegal test kit? Have you found out about it? Have you gotten a sample so as to see if you can reduce the cost of testing and make it cheaper to be available for everybody?
I'm in touch with my brother Amadou Sall in Senegal almost every week. Those kits are not available yet. They will become available through an agreement across Africa sometime in July if everything goes well. Once it's available, to every Nigerian. Our goal is to make tests. I don't know what is being mixed in Madagascar when I have it. It goes through a testing process through NAFTAC, and then we'll be able to make a decision. But you cannot. In Senegal, I understand exactly what the test is going to do. I understand the processes. The colleagues in Senegal are completely open with what the test is, working with a company in the UK.
Right.
In the Madagascar solution, nobody knows what is in that bottle. So I cannot
Okay. All right. Cool.
offer that to Nigerians until we know. That is a sacred responsibility I have for all Nigerians.
We have to wrap up, though. Thank you so much for joining us. A pleasure. We hope we can have you as often as possible because, trust me, we enjoyed this conversation. Thank you for joining us this morning. Right, so we're speaking with the DG, National Center for Disease Control, Dr. Chikwe Ihekweazu. Let's go on a break. When we come back, we'll be talking to the Commissioner for Information in the Lagos State to know what's going on and what their plans are to ensure that this doesn't spread. Stay with us. We'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So yesterday, the lockdown was eased in Lagos State and the Federal Capital Territory. But sadly, Nigerians fear the drastic increase in contracting this disease as people are going about their daily lives like nothing happened. Public policies are complying with not complying actually with social distancing. Joining us right now to discuss more about what's happening in Lagos is the Honorable Commissioner for Information, Mr. Gbenga Omotosho. Good morning, sir. Are you there?
Good morning, I'm here.
Good to have you on the show. So yesterday, obviously, was the first time we eased the lockdown. And obviously, we saw quite a number of, I think it was more of banks, bus stops, and markets, quite crowded. I know, as the NCDC DG said earlier, it was somewhat expected. But now, you're inundated with all this breaking of the law yesterday. What do you plan to do to help ensure that people understand the need to social distance and thereby reducing the spread of this virus?
Well, people have suggested so many things. Like you said, I think it's not, it wasn't unexpected. If you keep people indoors for about 5 weeks, you expect them to just bust out and feel that they have an air of freedom. That is okay, but we have been trying everything to tell our people that this is not the time to feel free. It's the time to actually be responsible, to take responsibility for the health of us, because what we are fighting is a public health battle. And what we are going to do, like we have said, is just to continue to appeal to them that they should take responsibility. We are going to step up our advocacy to tell them how dangerous this enemy we are fighting is. The governor had a meeting with traditional rulers so that the message could go down to the grassroots. He had a meeting with local government chairmen. He had a meeting with market leaders. And such meetings will continue, and then we step up our advocacy to let people know that it's not eureka, right? Yes.
Right. Okay. Right.
So I wanted to ask about, I seem to live in a saner part of Lagos. The keke napeps in my area were 2 in 1 keke. The buses complied around what I saw, honestly. So, but I saw videos that were scary. I saw BRT bus loaded full. And my worry is, if we try to enforce, we might get the case of violence in trying to control these people. How do you want to balance enforcement without resorting to brutality or inflicted on the people that are trying to get to their place of work? What's the line, and how are you finding that balance, sir?
I mean, it's a delicate balance and very complex. Like I told you, I've never seen anything that persuasion has failed to achieve. Persuasion in the sense that we are going to, like I said, step up our advocacy, even as we enjoin the police to do their duty. Some people have even said that, why don't you bring out dogs? Why don't you bring out soldiers? I do not think that this is the time to abuse the rights of our people. It is the time for us to appeal to their sense of humanity.
Right.
It's the time for us to appeal to them, to let them know that what we are talking about is very dangerous, and that there is difference between life and death, and that we are choosing in Lagos State to live. And if we are choosing to live, we have to be responsible. We have to take control of our destiny.
Right.
And that is what we are going to be telling them through advocacy.
We have quite a few questions for you because we're hearing that the numbers in Lagos State, the health workers are getting infected. And that's really scary. What's going on with the PPEs in Lagos? Are they probably being distributed? What are you doing to ensure that our medical doctors are well equipped so they don't get continually infected?
Yeah, as far as I know, And from the records available, PPE is scarce all over the world because everybody is asking for it now. But I assure you in Lagos State, we are not running out at all. We are not running out because we keep on getting supplies. And our medical staff have not had any of them complain that he or she has not been given what he or she is supposed to get to protect himself.
Right, right.
I'm going to ask the question I asked the PTF chairman, because a lot of people are calling NCDC and are calling the Lagos State hotlines, and they are not getting answers. And some of them, someone I know died, like he had been calling NCDC last week, and then, or he had been calling the hotline numbers. They picked him up late at midday on Sunday. He died 4 hours later. You know, a lot of people are complaining about, they're calling the hotlines. We've even had a couple of calls on this show and saying, so how are you going to solve this problem?
Well, people have said that, but what we have discovered is that most people who have been calling numbers, they call NCDC numbers. And NCDC is not based in Lagos. From NCDC, they have to refer them to Lagos. So it takes a long time. But the lines that we have in Lagos, they are working, they are alive. People are there 24 hours. When you call, they answer you. Since the governor announced that people should be calling Lagos State lines, and we release those lines, which are being scrolled on television all of the time,
right.
I think such complaints have come down.
Okay.
People being picked up late, well, I know that everything has a process. If you are going to pick up people, you have to be well kitted. It's not about one person going to pick up just another person as if they are going to a party. They have to dress up properly, and there are a number of protocols that they have to go through before going to pick up anybody. So it could be late at times. And even when you get there, for the process of admission too has its own protocol, which is not like taking out food from McDonald's.
Right.
No fast food at all.
Okay.
Okay, sir, two quick questions. One, taking you back to the healthcare workers and the risk to their lives. So I watched a documentary on Greece and how Greece has been able to prevent spread to medical officials generally, not just doctors, nurses, everybody in the hospital. Nobody from the medical sector has contacted, even when they are treating COVID-19 patients. And I know that Nigeria, when we talk about these things, we tend to quickly go to America and UK and say Italy is also struggling with it, but we're not looking for examples of countries that have been able to successfully curb it. So my question to you, sir, is how are you reaching out to countries that are working and successfully mitigating and reducing the spread of COVID-19? And are you trying to adopt those systems as opposed to us doing what we know hasn't worked for developed countries?
Well, don't forget Lagos is a city-state. We are not a sovereign country within Nigeria. Everything that we do, we look up to the federal government, so as not to be seen as bypassing protocol. But be that as it may, I assure you that everything that should be done, every contact that has to be made, is being made in this particular case, because we have officials who are members of a world organization, and they are in contact every second, every minute. Most of the things that we are using are not being manufactured in Nigeria. And I have been telling you that we are not running short in a way that we are reaching an emergency stage. And all of this is because we are in contact with people outside the country. So in terms of cure, in terms of vaccine, in terms of equipment, we are on top of it. We are talking to colleagues all over the world for us to know what to do.
We have to go on a quick break, sir. I'm going to put you on hold for a quick second. We'll be right back. We're going to continue this conversation. Stay with us. Don't go anywhere. We'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So we still have with us the Commissioner for Information, Mr. Gbenga Omotosho. Hello, sir.
Hello.
So my first question to you is, the governor actually on Sunday made a U-turn on asking civil servants to not to resume work on Monday. What informed that decision? Could you tell us, please?
Yeah, we wanted to show examples because we told everybody that private companies should please not allow everybody to resume at the same time. That even when you are in an office, you have to use 60% of the capacity of the office and to ensure that you don't have more than 20 people at a place at a time. So we wanted to show that example and lead the way for people to follow. So we asked everybody not to come to work here today, and that even as from Tuesday, it has to be level 15 and above.
Right. Do you think that's what informed the banks not opening all their branches? Because yes, a lot of banks didn't open all their branches, and maybe it's from that directive, the 60%.
I do not think so. I am not a banker, but I feel that maybe the banks were looking at it from a security perspective, that if they open like that, there may be the kind of thing that you experienced yesterday. But I think that, in my own personal view, it wasn't that right, a decision for them to have taken. They will have opened all their branches and then strengthened the security as much as possible so that the kind of rush we had yesterday shouldn't have happened.
Okay, sir, I wanted to ask you concerning the borders to Lagos, especially because people always say that Nigerian borders are really porous. There are multiple ways to get into a country. There are some corners. People don't follow the highway. How well are we protecting Lagosians from importing more disease into
Let's
our
just ask
community?
about what happens, Zamfara. I mean, yesterday there was a truck that came into Lagos State. They had cows in, but there were 42 or 60 people actually hidden within that truck. And Nigerians and Lagosians are worried that there are other entries into Lagos State. What are we doing to ensure that we don't have more influx, especially because most borders are supposed to be closed, and we don't want that communal transmission across the country? So I know it's going to be overwhelming, but what are you doing to at least ensure the reduction of these trucks coming into the state?
Yeah, we have had stories of people trying to sneak into Lagos on the pretext that they are bringing in food. And I assure you we have done a lot about that. Apart from the security agents that you see at the boundary, we have sent in members of the neighborhood watch. And apart from that, we have spoken with people, community leaders. Like I told you, the governor had a meeting with the traditional ruler state before yesterday, and then council chairman. And all of this is just to tell our people that if you see any strange face in your community, please monitor and report to the authorities. In fact, we released some lines, whistleblower lines. And apart from that, you can recall that a few weeks ago, about 67 Nigerians who are trying to come into the country were stopped at the same border. And we had to take them into isolation, about 67 of them. And they were tested and kept there for over 14 days and were released after none of them tested for COVID-19. And apart from that, there were 32 others who were trying to come into the country too, and they were taken into isolation. I think any moment from now, they are going to be released. I think about 2 of them tested positive to COVID-19. So we are doing everything.
Talking about isolation centers, we got a report last week that we're lacking beds, that Lagos State is having issues with bed spaces. Is that correct? And if it is, what are you doing so far to ensure we have enough isolation centers for these people?
Yeah, there is stress on the isolation center. I won't deny that. They are up to about 90-something% occupied now. But you will recall that just a few days ago, the governor opened another isolation center, 118-bed isolation center at Bagada. And as I speak with you, another one is coming up speedily in Yaba. And as I speak with you, there are so many other properties that have been acquired for isolation centers that should it come to that point that the ones that we have now that we run out of bed space.
When you say acquired, when you say you've acquired a lot of isolation centers, what process do you go into acquiring? Do you just enter somebody's property and acquire it, or I mean?
So what I mean is that there are hotels, personal, private properties, that 60-bed hotel, 40-bed hotel, 50-bed hotel that we have paid for. I've just told you that about 67 people were released in SMA. They were camped in a hotel in Badagry for over 2 weeks. And there are some other 32 people now who are in hotels in Badagry too, who are going to be released any moment from now. So there are private arrangements like that are not being announced, so that there will not be a kind of stigmatization on these facilities after COVID-19.
So Rivers State has said that every flight, specifically helicopter flights, carrying essential oil workers into a state needs to stop bringing the details of every passenger before they arrive, and the flight performer must be. Is Lagos doing the same thing? Because we know many people are coming in and going out through flights for essentials. Is Lagos implementing that same kind of stringent move to prevent importation of more?
Yeah, like I've told you, we don't have any powers over the airport, but any flight that comes into Lagos, I assure you, our health officials are there. Even before the federal government saw the flights, we had scores of people manning the airports and ensuring that people don't import COVID-19 into Lagos.
Right.
There is a question, please. There is someone saying that Nigeria should please do more door-to-door testing. It will go a long way. I wanted to ask, how far with your own door-to-door testing in Lagos State? Because I haven't seen anybody.
I'd like to add to that too, just so I do it once and so you can answer together. In addition to the door-to-door, we know Lagos State also had the local government sample collection centers. How effective has that been? And do you think you're going to expand that to the LCDS also, so you can get more samples in? So you can answer it together.
Yeah, door-to-door testing has been going on. We are collecting samples. As of last week, there were over 1 million. And if we look at maybe just conservatively, if you say there are 6 people in a household, then we are talking about 6 million, more than 6 million people that have been tested. And then concerning the sampling centers at the local government, they are up and running. But the problem, I will not deny this, is that we have a backlog of tests to do, because there is a shortage of reagents. And the shortage of reagents that we are talking about, the government spoke about it 3 days ago. It's not a Lagos State problem, it's a global problem. Reagents are very scarce and very expensive, and the government even sees that occasion to appeal to people who are selling that this is not the time for people to make a profit, that it is the time for people to show that we are humane, because humanity is faced with a calamity that is unprecedented, and that all of us will come together and fight it. That it's not the time for us to make money, but for us to make people live.
So the samples are collected, it's just that we can't test them.
We don't have enough reagents.
Okay, unfortunately, we have to run.
How do you go to when you go to the house, you just say, everybody come out, let me test you. Or you ask, do you have the symptoms? How do you do it?
It's a team. The team goes and they choose where to go randomly, and they introduce themselves, they show their ID card, and then most of the time they are carrying vehicles with COVID-19 banners on them. So people know them.
Right. All right. Well done, sir. Thank you very much.
Thank you, sir.
And we hope to hear from you soon, because we'd like a continuous update from your office. Thank you so much for joining us this morning. We've been speaking with the Commissioner for Information, Mr. Gbenga Omotosho of Lagos State. Let's go on a break. When we come back, we'll be getting some updates from Edo State. Stay with us. We'll be right back.
Stay tuned. Your View will be right back. Welcome back to Your View.
Thanks for staying with us. So we have with us the Commissioner for Health, Edo State, Dr. Patrick Okodua, to give us an update on what's going on in Edo State. Good morning, sir. Are you there?
Yeah, good morning.
Yes. We haven't heard from Edo State so far since since we've been talking about COVID-19. We'd like to know what's happening in your state. We know you have about 62 confirmed cases, 4 deaths so far. How has it been? Is the state locked down as a governor enforced the lockdown within? And if they have, how is that going so far in Edo State?
Yeah, good morning. Nice to be here. Let me just start by saying I have to excuse myself from the task force meeting. Being chaired by the Executive Governor, Mr. Godwin Obaseki. We have these meetings every morning, starting from 9, and the meeting is still in session, trying to address issues. So far, so good in Edo State. say that we had a tough time at the very beginning trying to put a lot of things in place.
Right.
It involved trying to put and use science and data to approach the response to COVID-19 as it affects those states. Of course, we recall that we had a very index case on the 23rd of March. More importantly, at that period, those states was at the verge of hosting the nation in a national sports festival. Of course, the first case in Nigeria occurred on the 27th of February, and the person was from Milan, Italy. So that drew a lot of apprehension amongst the people of those states, and the fact that there is virtually 1 out of 3 houses in those states having a relative in Italy. So the states needed to immediately swing into action. The Emergency Operations Center was immediately activated.
Okay.
The governor of those states immediately constituted the task force, which he chaired, and the technical working committee was also inaugurated, and that was being chaired by the deputy governor himself. We had some good experience in terms of outbreak responses in the state, knowing fully well that Edo State was the epicenter of Lassa fever outbreaks for many years now.
Right.
And we have a center in Edo State in Irua that is designated as the Center of Excellence for Research and Treatment of viral infections like Lassa fever and Ebola. So these experiences we brought to bear, and it was neat to strengthen what we had. Before the first case in Edo State, we were boasting of just 2 isolation centers. One in Irua Specialist Hospital at the Edo Central Senatorial District, and then the other one at the state capital in Stella Obasanjo Hospital.
Right. Okay.
Yeah. So there was need to improve on this, and a lot of work was done. The effort was directed in 2 prongs: in the area of prevention and secondly, the area of case management. We've done a lot in terms of surveillance and social mobilization. Now we have a very well-structured surveillance team. Our contact tracers have been there with lots of experiences, so we needed to do a lot more in terms of training of more healthcare workers.
Okay.
Totally,
all right.
yes.
Let me get a few more questions.
Your government came under fire recently for spending 1 billion. Could you just, clarify it to to everybody, how that money was spent and why you needed so much?
Now, it's difficult to really break down the expenditure. On a daily basis, money is being spent. I think my governor just gave an estimate of the amount of expenditure has been going on. It is actually at the end of that break that you can decide to say how much was really expended. So far, it's an emergency situation. Activities are going up. Things are coming up every day. As we speak, we are working on building a 350-bed isolation center, which is at the Stella Obasanjo Hospital. The hospital was designated as a COVID-19 response center.
Right.
It boasts of all the facilities you can have with the global best practices applied.
Okay.
We've trained 4,218 healthcare workers.
Wow.
The governor of the state has approved incentive for all the healthcare workers who are involved in frontline management of COVID-19 in the state.
Right.
We have procured molecular polymerase chain reaction, the PCR machine. Though we had one in Iraq Specialist Hospital that was serving the whole of south of this country, but there was need to increase the laboratory testing, the capacity. So the governor went forward to get 2 extra, one at the University of Benin Teaching Hospital and another one at the Edo Specialist Hospital.
Okay.
This, we believe, will go a long way to get our people tested, and so we stop the community spread of this infection.
Right.
Oh, thank you, sir. So there are 2 quick questions. We know in Lagos now that we're at the level of communal spread. It's no longer we can't definitely be isolating and tracing every confirmed cases as much. What is the level of communal spread within Edo State 1? There was also news a few weeks back that the University of Benin Teaching Hospital had an episode where somebody came in without disclosing their travel history. How was that resolved, and how are you keeping a curb on having full-blown communal spread?
So, I get the first question, but the second question wasn't very clear. But to respond to your first question, it's becoming obvious that we are actually in the phase of community spread. And so efforts are eventually being geared towards that because we prepared for it. And we are doing what we call the screening exercises that is going on now. It's a wide, large-scale screening. We do the fixed screening across the 18 local government area of Edo State. We started from the very 4 local government areas that recorded the high cases of confirmed coronavirus disease. We scaled up to mobile screening. This one has already spread to 2 local government areas. We set up screening posts at our borders, or at almost 18 border entry into the state. And there are personnel facility with the police and the security support to screen people as they come into the state. So these are efforts put in place to check and prevent or cut the chain of spread. So it's still an ongoing process. As we speak, about 9 out of our 18 local governments of Edo State already has recorded 1 or more confirmed cases. The other 9 are actually not having any case so far, but screening exercise will eventually get there to get our people screened and possibly get them tested to bring them out of the
Let's go to the case of the health workers, because globally there's a shortage in PPEs across. So various states and countries are battling to ensure that their health workers have enough. In your state, what have you done to acquire enough? And do you think you'll be needing more for now?
Thank you so much. I'll just answer that last one. It is always important to say you can never get enough. In this fight, we do not know the extent to which we can go. But however, a lot of arrangements and procurement has been made. The health of each healthcare worker, the life of each healthcare worker is paramount in the faith of our governor, and he sees whatever is required to get our healthcare workers safe and protected. We have to go to that extra mile. All our healthcare workers have enough personal protective equipment, which are located at all our isolation centers across the 3 senatorial districts. In addition to this, we've identified that not even isolation centers alone that has the risk of exposure, but all public and private health facilities. So we have engaged the private practitioners, and personal protective equipment has been distributed to all our private practitioners, all the general and secondary and primary healthcare centers in the state to get our healthcare workers fully protected. And this is going well because we have not recorded any healthcare worker getting exposed or getting infected in Edo State yet.
Oh,
thank you.
The news we had, there's a news as at our first week of April that 25 medical officials were exposed in University of Benin Teaching Hospital because 3 patients confirmed positive to COVID-19 and they were isolated.
I will speak to that. There was a mix-up in the reporting of a laboratory test.
Oh.
Now, 3 patients in admission at the University of Benin had their samples collected and sent to, at that time we had only 1 testing center at Irua Specialist Hospital. It takes an average of 1 hour to 1.5 hours to travel from Benin to Irua Specialist Hospital. The information is that by the time the sample got to Irua Specialist Hospital, it was late. And they have already done the testing for that day. So the Irua Specialist Hospital laboratory scientists batched it for the following day. However, their reports came out for the samples that were collected for that day, and it came out that there was no positive case from Edo State. And of course, UBTH assumed that the samples that were sent at that day was already being reported. So they assumed that there was no positive. However, one of them was positive. It was the following day the result came out. We are also, and our people and the healthcare workers have been told on the principle of universal precaution. Right. So whether a patient is positive or not positive, the measures of attention and protection for the healthcare worker is the same. So it was the fact that it raised doubts that when the result came out the following day, they said, they said they've been exposed. Well, the needful was done to keep all of them in isolation for 14 days, and even samples were collected from some. None of them eventually came out positive.
That's
So
good.
that is the outcome of that event.
Were you successful in tracking down the pregnant lady that escaped?
Right now, we are still on it. Amaka Okoro is a lady with a baby who has been tested positive. We are yet to get her, and we have been still sending message of appeal to her or relatives of hers to come. It's not like a sentence. It's not like an accusation. She's not under any form of a crime search. We just appeal to her for her sake and for the sake of our people and our loved ones to come in. We've had several reports and presentations from some other ladies who happen to bear the same name, and even their profile falling within the same as hers.
Right.
Of course, we've confirmed that those are not the real Amaka
Okay,
Okoro.
let me take a few tweets for you.
To appeal to a real Amaka Okoro. Please come. We will take care of you. All our patients are in the isolation center. They are well cared for. They are being fed, and the treatment is given to them, and they recover quickly, and they go back home happily.
All right, let me take a few more questions from tweets. Go ahead.
Okay, there is a tweet here from Obo Lawrence Osezua. He says, I should please ask the Edo State Commissioner how they are working with Pax Herbal Ewu, Edo State, with respect to treatment they are working on.
Come again, how we are working with?
With Pax Herbal Ewu.
I didn't get that.
Pax Herbal.
Pax Herbal.
Herbal.
Yes.
The traditional medicine.
Yes.
Okay. Well, we have a traditional medicine board in the state, under the State Hospital Management Board. However, there is no form of collaboration. They have not presented any form of discovery through their members to the state that they've made any discovery with regard to the treatment of coronavirus disease. We say we are not averse to any individual organization who has genuine and follow due process of scientific research and trial to present a cure. We will promote and we will send it through the highest level of scientific study and trials to get people out. But there is so far none. Thank you.
Sir, the herbal treatment people, a lot of them are coming out on social media to say that they don't have access to the patients. All the patients are in the custody of government. That's the expectation. So for them to treat, the question you're asking is, show us evidence. They say they have a cure. They are saying, give us access to the patients. Give us one patient that we can treat, and then we can now show you. But
thank you. Please don't work that way. This is an organized and a civilized society. No matter what cure you have, you do not have access to start implementing if it does not go through the process. The government has the responsibility to the people, and if you come out with any, you must come out, declare it, and show the evidence before the state. Then you get the approval. We are not even going to the national level of getting a NAFDAC approval.
Right.
So if you do not have that, you do not have a right.
Okay, we have to wrap up soon. I need to ask, because the Lagos State initially had some challenges with important or VIPs going to certain hospitals for treatment. They didn't want to come to the state infection disease center. In your state, are you having that issue where some influential people that could have been positive are choosing to stay in private hospitals? Are you having that challenge in your state? And if you are, how are you handling that?
Well, I must state here that the protocol for managing COVID-19 is developed at the Nigerian Center for Disease Control. And there are provisions for VIPs and other special patients. We in Edo State have facilities for the very, very important personalities. Isolation centers are also created. Holding centers are also available for the very important persons, just as we have a bigger ward that could take the other members of the society. So our recommendation is, if any of our persons is confirmed and is diagnosed, we move the person. If he doesn't want to stay in the general wards with the other, we have facilities that can take care of them. That is what we do now.
Okay, all right. So there's a lot, so we have to let you go now. Let me let you go back to your meeting, but thank you so much for joining us this morning. Appreciate it.
It's a pleasure. Thank you for
Thank you very much.
That struggle.
Yes,
thank you.
We're speaking to the Commissioner for Information, Dr. Patrick Okudua for Edo State. I think we've had a good meeting today, a good show today.
Yes, we have.
We've been trying to get the NCDC Boss
It's
for a
not
while.
a meeting, it's actually a show.
Right.
And it's an update, our own version of update on COVID.
Yeah.
19.
Well, I think it was a good conversation because we've been trying to get the NCDC Boss for a while. And unfortunately, so we're happy he came, but we try to get him as often as possible because the truth is that Nigerians do share with us their own fears concerning this, the spread, and it's important that he hears from us. And many of them do watch the show, and we appreciate it. And I think we can close the show today. Yeah. Thank you so much, ladies, for joining us. That's all we can take. Hope you learned as much as we did. Have a fabulous day. We'll see you tomorrow. Bye for now.